Hello, I'm Derek McGinty, and on behalf of AARP, I want to welcome you and thank you for joining us. Today we're going to discuss how you make the most of the open enrollment period for Medicare. Now, before we get started, if you'd like to listen to this program in Spanish, press *0 on your telephone keypad right now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
Well, now today we are going to talk about how you can make the most of the open enrollment period for Medicare. If you are already enrolled in Medicare, this conversation is for you. We're going to challenge you to take control and reassess your Medicare choices by considering your lifestyle, your health, and your financial needs. We'll talk about the common considerations that Medicare beneficiaries ought to be thinking about. We are connecting with thousands of AARP members from all across the nation, and we'll be joined shortly by thought leaders who will take your questions live. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years now. And we're in your corner, fighting on issues that matter to you and to your family. Now, if you've participated in one of our tele-town halls before, you know this is a lot like a radio talk show where you have the opportunity to ask questions and get answers from our guests. And for those of you joining us via the telephone, if you'd like to ask a Medicare-related question, press *3 on your telephone to be connected with an AARP staffer who will note your name and your question and then place you in a queue to ask that question live. If you're joining us on Facebook, you can post your questions in the comments. Well, hello. If you are just joining us, I'm Derek McGinty, and on behalf of AARP, I want to welcome you to this important Medicare discussion, Medicare That Fits Your Life, a guide to open enrollment. Thanks for joining us today and participating in our tele-town hall. Again, if you want to ask a question, please press *3. And if you're joining us on Facebook, you can post your question in the comments. All right, listeners, we'll be sharing resources and phone numbers with you today, so you may want to grab a pen and paper just in case. Today, we're joined by two very special guests. Andrew Scholnick is Government Affairs Director for AARP, and Xavier Vaughn is Advisor for Medicare Programs at AARP. Andrew and Xavier, so glad to have you.
Glad to be here.
Now, if you are already in the Medicare program, you might remember your initial enrollment process. You might have spent a lot of time researching the different Medicare options and learning Medicare terminology and trying to predict what your out-of-pocket costs might be. And if you're anything like me, you were really relieved when it was all done and you had your health insurance in place. But maybe since then your needs have changed a bit, or maybe you're not quite so happy with what you chose. You might feel stuck, but you definitely are not. In addition to that initial enrollment period, Medicare also has an annual open enrollment period that gives you a chance to reevaluate your previous Medicare decisions and make sure you have the coverage that works best for you. Yeah, you heard right. Open enrollment is sort of a Medicare do-over, only this time you're armed with some first-hand experience. So, if you're not quite satisfied with your current Medicare coverage, or perhaps you're just curious about what other options are out there, you've come to the right place. We'll be going over lots of information to help you understand open enrollment. With open enrollment starting in just 3 weeks on October 15th, now is the perfect time to start preparing. So, Xavier, I'll start with you. Let's talk about the basics of open enrollment. What do folks need to know?
So it's really important to note that open enrollment is the same exact time every single year. It is October 15th through December 7th. Does not matter which day of the week it falls on, it will always be October 15th through December 7th. And why is it important for people to look and reassess every year during open enrollment? You could save money and get better coverage, potentially. Every year, our lifestyle, our health, and financial needs will change over time. So it's important to take stock each year to see if your Medicare choices is still the best choice for you for the upcoming year. Also, your doctor may be in and out of network, or maybe some of your medications have changed and they're no longer covered underneath your current plan. So it's just really important to take the time and take control of your health care and what your health care needs are, and to reassess your Medicare options.
All right, thank you so much, Xavier. Andrew, your turn. If you're satisfied with your coverage, why should you pay any attention to the open enrollment period?
Well, if you're happy with your plan, fortunately, you don't have to do anything. But every private plan in Medicare, which is Medicare Advantage health plans or Part D prescription drug plans, they do have the ability to change their plan each year. They can change their premium, their deductible, their copay, or even some types of coverage from year to year. So it's important to see if any changes have happened to your current coverage, and you would be notified about this through an annual notice of change letter that the insurance companies are required to send to you. Again, now would be an ideal time to just pause and take stock of your coverage and make sure it still works for you. As Xavier said, maybe you're on different medications, or maybe you switch doctors and want to make sure that your current doctors are still in your provider network if you have an MA plan. So open enrollment is the time to do all that.
All right, thank you so much, Andrew. Good to know that any changes coming our way in Medicare Advantage or Part D plan are not going to sneak up on us, and we'll be sure to be on the lookout for those annual notice of change letters. So again, Andrew, speaking of changes, I understand there were some items worth highlighting for 2025 that impacted Medicare beneficiaries. So perhaps you could tell us about those.
Sure. There were a few big changes in Medicare in 2025, particularly regarding prescription drugs. For starters, insulin prices were capped at $35 a month per person. So anybody with diabetes or needing insulin only had to pay $35 a month for a month's supply. Also, in this year, there was a cap placed on all prescription drug plans, limiting how much a person paid out of pocket for their drugs. Now, this coming year, that cap is going to be $2,100, which means that once you've spent $2,100 or $2,100 out of pocket at some point during the year, you won't have to pay any more for your prescription drugs. They also instituted what's called the Medicare Prescription Payment Plan, which allows you to pay over time. So instead of getting sticker shock at the beginning of the year for one really expensive drug, you can pay that amount over a period of time to kind of even out those costs. Now in 2026, another exciting change is happening where the first batch of prescription drugs that Medicare is allowed to negotiate for goes into effect. So these are 10 drugs that tend to be high-cost drugs. Medicare negotiated the prices for the first time, and we will see new prices for these select drugs in 2026.
Well, Andrew, that is great news for folks managing their prescriptions, and certainly it's something we need to take into account when considering whether we're going to make changes during open enrollment. Okay, Xavier, what is the time frame for open enrollment again, and when do the changes that you might make take effect?
So open enrollment is October 15th through December 7th for both original Medicare and for those who are enrolled in Medicare Advantage. And their changes will take effect January 1 of the following year. It's also really important to note that there is also a Medicare Advantage open enrollment period, which is January 1st through March 31st. So for those who are on a Medicare Advantage plan, they have another opportunity for where they can shop around, go to a different Medicare Advantage plan, or drop their Medicare Advantage plan and revert back to original Medicare and pick up a Part D plan. And that will take effect the first of the following month.
Okay, wait a second. That last part's pretty important and caught my attention. I didn't have any idea that Medicare Advantage had its own open enrollment period in addition to original Medicare. You know, some of our viewers enrolled in a Medicare a long time ago, and they may not remember all those details. So can we back up for a minute and remind ourselves about the differences between original Medicare and Medicare Advantage?
Yeah, so original Medicare, or you may hear referred to as traditional Medicare, is your Part A and Part B. Your Part A will be your hospital, and your Part B will be your medical. And how I like to remember, if you put hospital and medical in alphabetical order, they coincide with their parts. And so for Part A, you're going to have some hospice care, skilled nursing facility assistance, and then with Part B, this is going to be your primary care and preventive services. And with original Medicare, it is possible to pick up a Part D plan, which is your prescription coverage or your drug, Part D, D for drug, and our Medigap are also referred to as a supplement plan to original Medicare. But you have to be careful about Medigaps. For those who are interested in Medigaps, it's really important to enroll when you're first eligible and sign up for Part B. For that way, you do not have to go through underwriting. If you sign up for at any other time, they will look at your health history and you may be denied, or you have to pay a higher premium at that point in time. Medicare Advantage, also referred to as Part C, is private insurance companies and it is federally regulated. These are what you're going to see all of your commercials. This is where you're going to see JJ from Good Times on. And so in this day and age, we love to bundle, right? We bundle our phone, our internet, everything into one comprehensive plan. Even our streaming services are now bundled. And that is the same approach that Medicare Advantage does. It bundles your Part A, Part B, and most of the time your Part D into one comprehensive plan. They're going to feel very similar to your employer-sponsored health care. And then also is really important to note that original Medicare has the same benefit and cost sharing nationwide and does not have a typical network like we have with our HMOs and PPOs with our employer-sponsored health care, just like the Medicare Advantage plan. Now, with that being said, Medicare Advantage plan can have different costs and added benefits, and they can vary from each state and even county level. There are pros and cons to each. For example, Medicare, there is no network. You can go pretty much anywhere in the country that accepts Medicare, but you also are responsible for 20%, and there's no cap. And then with the Medicare Advantage plans, you may have additional benefits, and you will have a out-of-pocket match that can also be quite costly as well. So it's really important just to think about what your current healthcare needs are, look at your family health history, and think what you would not want for only today, but what you're going to want in the future as well.
Well, thank you for that refresher, Xavier. I think I understand that original Medicare is called Parts A and B. You can add a Part D plan to your original Medicare for prescription insurance, or add a Medigap plan to cover some of those out-of-pocket costs. And of course, Part C is called Medicare Advantage, and that's a private insurance plan you can buy to replace original Medicare. Sounds like Medicare gives you a whole lot of options. So during open enrollment, can we switch in between them, Andrew?
Pretty much, yes. During open enrollment, you can switch between original Medicare and Medicare Advantage plans, or from Medicare Advantage to original Medicare. You can also switch between Medicare Advantage plans or choose a new Part D prescription drug plan. But again, you really do need to do your research to make the best choice. There are a few limitations to be aware of. First, you cannot add a Part D plan or a Medigap plan with Medicare Advantage. So if you choose Medicare Advantage, like Xavier said, that's it. It's already bundled. You can't add Part D or Medigap. Also, if you decide to leave a Medicare Advantage plan and go to original Medicare, you may have difficulty getting a Medigap plan after that. And also, if you happen to have retiree insurance, that can add a layer of complexity because of the interactions with your employer retiree coverage.
A lot of options there, kind of complicated. So when we're looking into it, trying to figure out what our needs are, how do we keep from getting overwhelmed, Andrew?
Sure, and yeah, lots of options means a lot of research. And it's great that everybody joined this call now in September before open enrollment starts, because this is a great time to start doing that research. It can take a bit of time. You don't want to wait till the last minute to make a decision like this. It's important to remember that no one size fits all. What works for your neighbor or even your spouse may not be best for you. So it's important to just pause and maybe write down an inventory of the drugs you take and the doctors you see or the hospitals that are nearby, so you have a reference point to know what you're looking for, and make sure that the drugs that you take are on the Part D plan formulary, and the doctors that you want to see are in the MA plan network, or make sure that they accept original Medicare as well. Now, fortunately, AARP can help get you started in that. We have a great website if you visit aarp.org. We also recommend people visit their state's State Health Insurance Assistance Program, or SHIP for short. You can find your local SHIP at shiphelp.org. Again, that's the State Health Insurance Assistance Program, or SHIP for short.
Great answer, Andrew. Thank you so much. We appreciate it. We've got a lot more content to get to, but first, listeners, we want to get to some of your questions about Medicare. So to ask your question, please press *3 right now on your phone. Well, now I'll bring in Julio Rios, who's going to help facilitate the phone calls. Welcome, Julio.
Hey, Derek. Happy to be here.
Good to have you. So what's our first question?
Our first question is for Andrew, comes from Doretta in New York.
All right. Doretta in New York.
Hi, Andrew. Can you hear me? I'm actually from Long Island, New York. Can you please let me stay on the line until you answer my questions? Because last time I tried one of these, they answered the first one partially, and I couldn't even interject. So I'm saying that now so that I'm on air and you can actually have that recorded. I'm curious. My husband and I both turned 65. I did in August. He did in April. He is currently employed. The contract he has is ending in December. He's looking for another position. Our health insurance is with the company he is with now, both health and dental. So when we picked Medicare, when we registered, we did not have to pick a Part B because we currently have health insurance. What I'm curious about is what would be a good pick for us when we're done in December, if he does not find other employment. Should we stay on COBRA? And also, our question is, where do we find dental insurance as a retiree that doesn't have it through the company anymore? Because I recently had to go and have a tooth extracted. I'm under dental coverage for insurance, Delta Dental, and unless we stay on COBRA for the dental, which we only stay on for a short time, they also don't have any coverage for
Doretta,
implants.
Let's let Xavier answer some of that question for you because
Sure.
we're branching way out. Andrew, you go ahead.
Yeah, I'm happy to answer all parts of that. So if you're planning on leaving employment in December, or your husband is, even if you may regain employment somewhere down the line, it sounds like you'll have COBRA coverage for a period of time. When you leave employment insurance, you have what's called a special enrollment period. If you've turned 65 previously and didn't take Part B during your initial enrollment period when you turn 65, you have what's called a special enrollment period. And that is an 8-month window in which you can sign up and not be penalized for being late. So you have a bit of a grace period if you want to decide what your future is or it takes time to find something else. Now, the important thing is you got to keep track of the calendar because even though you have COBRA, COBRA does not count as creditable coverage for the purposes of Medicare. So you will, within that 8-month period after your husband leaves employment, you'll want to sign up for Medicare. You might even want to sign up even if he does get another job because depending on that employer, there's different interactions with the size of the employer, and they may want him to sign up. So it's probably a good idea to sign up for Medicare in December anyway, but you will have like an 8-month period to kind of figure that out if you want. With regard to dental coverage, you are correct. Medicare does not, traditional Medicare or original Medicare does not offer dental coverage. Some Medicare Advantage plans do. Many offer it to a certain degree, which would be like a couple preventative cleanings and then maybe like a certain percentage of other services. So they all vary. There's no real rule about what they can offer. You would have to either check out Medicare Advantage plans specifically. If you choose to get original Medicare, you can buy a standalone dental plan, and those are offered by a bunch of different insurers. The big ones typically do, United, Delta, others offer standalone dental coverage that you can buy directly from the company.
All right, Andrew, thank you, and congratulations on answering a very tough, complicated question. We appreciate you. Julio, who's our next caller?
Our next question is actually for Xavier, and Jeanette from Facebook asks, how soon do I need to sign up before I turn 65? I already get Social Security.
So lucky for you, Medicare will be automatic since you are already collecting Social Security. And so you have a 7-month period of time where you can sign up for Medicare when you're new to Medicare. So you have 3 months before your birth month, and 3 months after your birth month. The one caveat is if you are born on the 1st, then your birth month moves up a month. So I always use my Uncle Charlie as an example. He was born on June 1st. Even though his birth month is June, When it comes to Medicare, his birth month was May. It moves it up a month. And so during those 7 months period of time, is when you can sign up and for Medicare, and you can get your A and B, and if you decide to do the Medicare Advantage route or the Part D Medigap, you can do all that during that time.
All right, Xavier and Andrew, thank you so much for taking on those questions. We'll go back to our phone lines in a little bit. In the meantime, though, Xavier, if you're already enrolled in Original Medicare, what should you be thinking about, especially if you're not really satisfied with the coverage you chose?
Yeah, so one of the things that you need to consider are your copays or your out-of-pocket costs. Are they too high? As I mentioned earlier, with Original Medicare, you are responsible for 20% of your Part B costs, and there is no cap to that. So you may want to think about changing to a Medicare Advantage plan where you can have some set copays and you have a set out-of-pocket max. Maybe if you want to add vision or dental, also Medicare Advantage may be a thing to look at as well. Or Andrew mentioned during the call, you can also look at picking up some standalone plans as well. And it's also really important to note with the Medicare Advantage plans that the hearing, dental, and vision probably is not comprehensive coverage. Some plans you can upgrade to make it comprehensive for additional costs. Maybe your prescription drugs needs have changed. Maybe when you receive your annual notice of change, you notice that a medication that you're currently on is no longer covered. So you may need to change and look at a different Part D plan. And it's really important to look every year to make sure that all your medications stay on formulary. And what a formulary is, it's just a list of medications that plan covered. And so it's really important to make sure that all of your medications are still covered year after year. And employer-sponsored retirees insurance might change as well. So just be aware of those rules that your employer may be implementing through your retiree coverage.
Okay, Andrew, you mentioned Medigap plans. It sounds like the rules change a little bit when it comes to those.
Yeah, there are pretty complex rules with regard to Medigap, and again, those are only for Original Medicare. And even though Medigap can be complicated, there are still some reasons why somebody might prefer Original Medicare. One of which is that the benefit in Original Medicare is consistent and stable. It doesn't change from year to year typically, or at least not by much. And pretty much every doctor in the country accepts Original Medicare. There is no provider network, so you don't have to worry about being in network or out of network. Any doctor that accepts Medicare will accept you in wherever you might be. And this is important in case you travel a lot or have multiple residences. Perhaps you spend the winter months someplace nice and warm. So with Original Medicare, you can see any doctor anywhere. With some Medicare Advantage plans, you have to stay in network. Otherwise, they charge you a lot more to go out of network based on your location. So again, if you choose Original Medicare, you have the ability to get a Medigap policy along with that. And Medigap is supplemental insurance that you can buy in addition to Original Medicare. And this helps with those out-of-pocket costs, like your co-payments and deductibles and co-insurance. Now, again, the rules are a bit tricky and slightly different with Medigap, particularly because you have really just like a one-time enrollment period or initial enrollment period. And this is when you first sign up for Medicare. If you choose Original Medicare, you kind of have to buy the Medigap at the same time or within a few months. And again, it's tricky because Medigap also uses an alphabet system to differentiate their plans. They're named by letter, just like regular parts of Medicare. So in Medigap, you have 10 options available. It's called Plan A, Plan B, Plan C. There's D, F, G, K, L, M, and Plan N. So you want to make sure you don't confuse Medicare Part A with Medigap Plan A, because they are different even though the letters are the same. Now, if you're considering buying a Medigap policy, it's important to research your options. Even though the state governments and federal governments strictly regulate Medigap plans still don't cover all your out-of-pocket healthcare costs. For example, Medigap plans generally don't cover long-term care like a nursing home or vision and dental care. They only cover what Original Medicare covers. Now, each of the 10 standard Medigap plans has different benefits and different ways of limiting your out-of-pocket costs. For example, all Medigap plans cover Part A coinsurance, but only some Medigap plans cover skilled nursing facility care or healthcare emergencies when you're traveling in other countries. Here's another example. In Medigap Plan B, it will cover all of your Part A deductible. Plan K only covers half of that cost. So once you determine the Medigap plan that meets your needs, you'll need to research the insurance companies that offer that plan in your area. By law, F or G plan sold by one insurance company must cover the same things that an F or G plan is sold by another company. But those insurers can and do charge different premiums for the same plan. In fact, the cost of Medigap premiums can vary quite a bit. So once you pick the type of plan you want, you have to decide which insurer you want to buy from. Perhaps the most important thing to know about Medigap is that timing is everything. The best time to buy a Medigap plan is when you first enroll in Medicare. If you purchase a Medigap plan within the first 6 months that you enroll in Medicare Part B, insurers must give you the best rates for your age. They also can't deny you a plan or coverage because of pre-existing conditions. But after that time period, anything goes. For example, if you don't buy a Medigap policy when you first enroll in Medicare, but decide a year later that you want one, insurers may be able to turn you down based on your health status or set prices higher because of pre-existing condition. How that works differs widely from state to state, though, and your state may have other periods when you can buy Medigap policies without any health questions. And if you happen to live in Massachusetts, Minnesota, or Wisconsin, your state offers different standardized Medigap plans as well. So another important thing to know is that changing a Medigap policy can be hard. If you want to switch to a different Medigap plan in the future, insurers may ask you questions about your health. So before you make a purchase, make sure you've considered your potential future needs as well as your current needs. Again, I know all this is a lot and confusing, so if you need assistance, don't be afraid to ask. We again recommend that the best place to go is your local state health insurance assistance program, and you can find them by visiting shiphelp.org. And each state and territory has a SHIP office, probably with staffed by volunteers that are in your neighborhood and convenient to you. They're a great resource. AARP recommends them all the time. They're unbiased. They're not selling anything. They're there purely to help you navigate this process. Again, that is shiphelp.org to find the one closest to you.
Well, I told you you might need a pen and pad before this was all over. Andrew, thank you so much. Let's talk a little bit about Medicare Part D. Xavier, can you tell us what sorts of things we should be thinking about when we get to open enrollment and have to choose Part D?
Yeah, so as Andrew mentioned earlier, since January, the Medicare Prescription Payment Plan has been providing the option to spread the cost of prescription drugs over the calendar year, making costs much more affordable for older adults throughout the entire year. And for this current year, there is a $2,000 cap on out-of-pocket costs. The cap for next year will likely increase to $2,100 with the inflation adjustments. And what you want to look for in a Part D plan is your coinsurance, co-pays, and etc. You also want to make sure that the Part D plan covers all your medications. And so a really great tool is to create a Medicare.gov account to see what medication you are currently taking and their costs. And the really great thing is that on Medicare.gov, it will pre-populate all the medications that you are currently taking. Even though it is pre-populated, I highly encourage you to go through that list to make sure that the quantity and the dosage is correct. Then you can select a pharmacy that you would like to go to, and then from there you can sort through the lowest monthly cost for the premium and the lowest monthly cost for your medication to see which plans will be there available for you for your lowest monthly total cost. It is really important to note that if you do not sign up for a Part D plan when you're first eligible for Medicare, unless you're still working, then you may have to pay some penalties. And the longer you wait to enroll in a Part D plan, the higher the premium is going to be. And if you qualify for Extra Help or another Medicare savings program, this will also eliminate your penalty. And these programs are really great. For Extra Help, it does look at your Part D plans, but Medicare Savings Program goes beyond the coverage for Extra Help and will also help cover some of your Part B costs as well. And it's also possible to switch to a Medicare Advantage plan for drug coverage.
Got it. Thanks for giving us the scoop on Part D. So we'll move on now to Medicare Advantage, as you just mentioned, Xavier. Can you give us a bit of a reminder about what it is and how it's different from original Medicare?
Yes, so a Medicare Advantage, also known as Part C, is administered through private insurance company, but it is federally regulated, versus the original Medicare, which is just a federal program. Often these Medicare Advantage plans can include extra benefits like hearing, dental, and vision, maybe delivered meal, transportation, and home modifications. And most Medicare Advantage plans will include drug coverage. Medicare Advantage plans are set up like HMOs and PPOs, which are just like your employer-sponsored health care. So they should feel very familiar to you. And even if you don't fully understand what an HMO and PPO is, it is something that you are used to. But original Medicare, there is a nationwide network, so you don't have to deal with in and out network. Some areas may have many Medicare Advantage options, or some may have just a few options to be available to you. And it's really important to know that from county to county, your offerage and the coverage can change. It's really important to note that to make sure that your doctor is in network, and I would verify on the plan website and also with your doctor office to make sure that your doctor is in office. And most of the time, drug coverage is built into that plan, but if for some reason the plan that you select, Part D is not included, you can add a Part D plan to it.
Appreciate the reminder, Xavier. But what about this question? Let's say you're unhappy with your Medicare Advantage plan. Can you switch to a different one, or perhaps switch back to original Medicare?
Yeah, so as Andrew noted earlier, the annual notice of change is sent in September, and this is when they will inform you of all the changes to your current plan. And from there, you may decide that that current Medicare Advantage plan is no longer the best plan for you. So during open enrollment, which is October 15th through December 7th, it is possible to switch from a Medicare Advantage plan to original Medicare. Also, as I mentioned earlier, there is the Medicare Advantage open enrollment period, which is January 1st through March 31st. And a person can switch to a new Medicare Advantage plan or go to original Medicare and pick up a drug plan. If you drop your drug plan in January, then coverage will begin in original Medicare and begin February 1st. If you drop within the first 2 weeks of February, then coverage will begin March 1st.
Andrew, I'll turn to you. Do you have anything else to add about open enrollment and Medicare Advantage?
Yeah, I would just reiterate what Xavier was talking about, where there is opportunity if you have basically buyer's remorse or feel like you made the wrong choice with Medicare Advantage after enrollment or open enrollment. That January to March period is very useful and important if you decided, after the fact that you want to go back to original Medicare, or you selected a Medicare Advantage plan that actually doesn't work for you. There's also another kind of benefit or opportunity. If this is the first time you've enrolled in Medicare Advantage, whether because of your initial enrollment period or if you've always had original Medicare and then decided to switch to a Medicare Advantage, if it's your first time in MA, you get a full 12-month period to go back to original Medicare and be able to get a Medigap policy again. So Medicare does kind of let you have that opportunity if you regret the choice that you made to go back to what you had previously or make another choice. But you only get that opportunity once.
All right. Well, thank you, Andrew. Well, right now, we're going to pause and provide a brief update on what's happening in Washington, D.C., and how AARP is fighting to protect your Medicare. Joining us now is volunteer Joe Garbanzos, state president at AARP California. Now, Joe leads the advocacy efforts all across his state on behalf of AARP, and he also works closely with Filipino-American veterans and other older adults to make sure their voices are heard. Joe, we welcome you.
Thank you, Derek. Delighted to be here.
Thanks for coming. Now, we are talking about Medicare, of course. So what is the AARP doing to protect older Americans?
So, firstly, greetings to all our listeners and participants at this tele-town hall. Terrific information so far shared, and I'm happy to add my own insight. To your question, AARP is fighting hard to make sure Medicare stays strong, not just for today's retirees, but for future generations as well. We at AARP pushing for improvements that make care safer, deliver good outcomes, more affordable, and access easier. This includes cracking down on waste and fraud and making sure your Medicare benefits stay protected and reliable, there when you need it.
Indeed. Now, I've heard concerns out there about Medicare Advantage plans and something called upcoding. What is that all about?
Timely question, Derek. The question is getting a lot of press coverage most recently. Some private Medicare Advantage plans have been inflating patient diagnosis to get bigger reimbursement or payment from the government, which is a major Medicare payer. The practice is called upcoding, as you referred to. It's costing taxpayers like us billions of dollars. Money that could be instead used to strengthen Medicare. AARP is supporting a bipartisan bill called the No Upcode Act, which is aimed to stop this upcoding practice. It's a common sense fix that protects premiums and helps keep Medicare financially healthy.
Really important stuff, Joe. Now, what about prescription drugs? Many of our listeners are struggling to afford their medications.
Yeah, you're absolutely right. Prescription prices are, in some cases, exceeding the inflation rate. So the good news is that for the first time, Medicare can negotiate prices for certain prescription products. This is a huge win for AARP and for the people we represent. AARP helped make this happen. Lower prices for 10 major drugs are taking effect in 2026. That's right around the corner. And we must keep on fighting, be vigilant to make sure that there are more to follow when it comes to price reduction. You know, our friends over at Big Pharma drug companies are still trying to delay these price reductions and savings. But at AARP, we're fighting back, making sure older adults don't have to wait years to see prescription price relief. And we believe it's doable. We believe that no one should have to choose between paying for basic needs, groceries, or their medicine.
Speaking of fighting back, what can listeners do if they want to get involved?
Terrific question. So getting involved, get engaged, participate in advocacy work, speak up. Call or email your lawmakers. Let them know Medicare matters to you, and so that's the cost of your medicine prescription. You can also volunteer with AARP in your community. It's a fulfilling way to give back, get involved, and stay connected. And if you want more information in terms of volunteering, staying informed, go to aarp.org/get involved and sign up for free advocacy newsletter and information.
That web address again is aarp.org/get involved. Joe, I want to thank you so much for being here and for all you do.
Thank you, Derek. It's a privilege. You know, as a volunteer, I stand on the shoulder of other volunteers and AARP staff, lending a voice for older adults and communities on many important issues.
Great job,
such
Joe.
as Medicare and affordable prescription pricing.
All
Thank
right,
you.
Thank you, Joe. Julio, let's get back to our phone lines. Who do we have?
Our next question is going to come for Xavier, and it's coming from Gloria in Michigan.
Gloria in Michigan, your question, please.
Hi. Well, I think I heard my answer. However, I will pose it again. I originally had Medicare Part D and a standalone, the Medigap. I guess that may be what it's called, right? I paid for a Part D, and I paid for prescription and dental. I then switched because of my employer to a Medicare Advantage plan. I understand we can change Medicare Advantage plans, but I would not be able to switch back, correct me if I'm wrong, to a
Xavier, why don't you take that one?
Yeah, so, and Andrew, if I misspeak, please comment. Comment. And so if you have a Medicare Advantage plan, you do have 1 year where you can go back and look and say, oh, I don't like this Medicare Advantage plan. I actually like my Medigap. I can go back and look if you do it for 1 year. So if you've been only for 1 year, then you should be able to possibly go back. And I saw that you were calling in from Michigan as well. And so I saw in Michigan, if you are already on a Medigap plan, then you cannot shop around and go to a different plan, but they are looking to change that in the future. I saw there's some legislation in the works for that to make it easier to shop around for a Medigap plan in the future.
All right, Gloria, I hope that helps. Julio, who's next?
Our next question comes for Andrew, and it's from Joyce from Maryland.
Joyce in Maryland, your question, please.
I'm a retired federal employee, and I had Blue Cross Blue Shield federal program while I was working, and I carried that into retirement. Since it is now my secondary carrier, and I have Medicare A, B, and D, do I really need to even think about looking at Advantage or Medigap programs?
Any thoughts on that one, Andrew?
Yeah, the short answer is no, you don't. If you have retiree coverage through the federal program or from a former employer that acts as your secondary payer or wraparound coverage, that basically is the supplemental Medigap coverage. So you wouldn't, if you're happy with it, you don't need to change. You're good with that. Medigap's really for people that don't have that opportunity of retiree coverage or secondary payer coverage, so that they could purchase this in addition. But it sounds like you're in pretty good shape.
Thanks, Andrew. Julio.
Yep. Our next question is for Xavier, and it comes from Facebook. Cynthia asks, I turn 65 next month and currently have medical insurance through my former employer as a retiree. I opted not to enroll in Part B for this reason, but am enrolled for Part A. I am now thinking maybe I should enroll in Part B and am looking for a good reason. I am looking for a good reason I should. How would that benefit me?
Yes, so if you are a retiree, then you will need to enroll into Medicare. So that is the reason why you would need to. And so employers and Medicare, they have it to where it's set up if it's great for a bridge between the two, but once you become Medicare eligible, then you would need to sign up.
So
for Part
the
B.
fact that she's already has Part A, she's got to get Part B too.
Yes.
Okay, I understand. Julio, we have another question?
That is all we have for right now.
All right, thank you so much. We appreciate all of your questions, and we appreciate Andrew and Xavier for answering them. I think we are seeing quite clearly that Medicare rules can get complicated. So the question is, where can folks go for clear answers on their own time? I'm sure you've all seen the advertisements out there about Medicare Advantage and Part D plans. Maybe you've gotten them in the mail or you see them on TV. Maybe even a phone call or two has come in. But let's face it, that comes from the insurance companies that want you to buy their products. So we can't call that exactly unbiased information. And unfortunately, Medicare scams can always increase during open enrollment. Xavier, tell us a little bit about that.
It's true. During Medicare open enrollment period, you may start seeing a lot of marketing materials about private Medicare plans, like Medicare Advantage plans and Part D plans. Companies reach out through TV, radio, and the mail, and even call or text you directly, and it can feel quite overwhelming. But there are laws to protect you from forceful or misleading marketing.
Well, perhaps you could share some of those rules with us. What are some red flags of fraud to look out for during open enrollment season?
First, the rules. Legally, marketing representatives from these companies cannot call you directly unless you give them permission, and they can't visit you in person without your invitation. They cannot use the term Medicare endorsed or suggest that their plan is a preferred Medicare plan. They cannot suggest that Medicare endorses their particular plan or imply that they are calling on behalf of Medicare. A big red flag is pressure to act. So if someone is pressuring you to join any specific plan, it could be the sign of a scam. At the very least, is the sign that that the person you're speaking with is breaking those marketing rules. A second red flag is if the communication suggests you could lose your Medicare benefits if you don't enroll in their plan. It sounds scary, but it's an empty threat. Be especially wary of fake Medicare representatives claiming card need replacement and Medicare cards remain paper-based with no plan change. Another red flag is if they ask for your Medicare number, Social Security number, or any bank information just so they can provide you with information about what they are selling. If they do this, it's another sign of a scam. Be careful. If you provide it, they can use it to enroll you in the plan without your permission, or they could steal your personal information.
Sounds like a lot to look out for. How can we protect ourselves?
To protect yourself, ask for everything in writing. Before you sign up for a plan, contact the provider of the plan directly to learn about the services it covered, and again, ask them to send the information in writing. If you suspect Medicare fraud, or if you suspect that an insurance broker or salesperson is not following the rules, report it to Medicare at 1-800-MEDICARE or 1-800-633-4227. You can also contact the Senior Medicare Patrol or S&P Resource Center at 877-808-2468, or the Medicare Fraud Watch Network at 877-908-3360. And finally, be sure to take your time to make any Please be sure to take time to make any decision during open enrollment. If you need help, be sure to reach out to an unbiased resource like your state SHIP and my colleague here at the Medicare Rights Center.
These days, we cannot be too careful when it comes to the sources of our information. So where can we go for legitimate, unbiased information on making Medicare choices?
Yeah, so there are a few, and now is the time to get your pen and paper ready if you haven't already done so. Okay, I hope everyone has their pen and paper ready, or their tablet, or whatever way you're taking your notes. The first is shiphelp.org, which is the State Health Insurance Assistance Program. Once again, that is shiphelp.org. And each state has one, and it gives free and unbiased Medicare counseling, and is not affiliated with any insurance company, and is actually a federal grant to do this type of work. The next is Medicare.gov, and you can go there, or you can call 1-800-MEDICARE, and that breaks down to 1-800-633-4227. Next, you have the Medicare Rights Center, and you can visit their website at medicarerights.org.
Fantastic, Xavier. Now, after thinking about all of this, what is the process like if we want to make a change, right? Is it a little different from initial enrollment where you have to sign up through the Social Security Administration? Do we send in a letter, make a phone call, maybe send a singing telegram to Medicare? How does it work?
Yeah, so no need for all that. And you will also need your pen and paper, again, to get all these get all this information. And luckily, most of it is just what I just said. So you can make changes on Medicare.gov, and from there you can sign into your account that we talked about earlier and search for a plan that's best for you. You can also call 1-800-MEDICARE. You can visit the plan site directly and enroll through that there.
All right, thank you for the great information. Now, we often get questions about the cost of Medicare. So, Andrew, I'll turn to you. Considering that your income actually does affect what you'll pay in monthly premiums for Medicare, can you speak to how that all works and how any changes to your income can also change your premium?
Sure, Derek. Again, there's three components to Medicare, or four if you count Medicare Advantage. But the main components are Part A, which covers hospitalization, Part B, which covers outpatient medical care, and Part D, which is your optional prescription drug coverage. And each of these have different premium amounts. First, let's look at Part A, which covers hospitalization. Now, most people don't pay monthly premiums for Part A. If you or your spouse had Medicare taxes deducted from your paychecks for at least 40 quarters of work, which is about 10 years, you're eligible for premium-free Part A coverage. Now, Medicare beneficiaries must pay a monthly premium for Part B and Part D, though. The federal government does subsidize Medicare premiums, but the more you earn, the less subsidy you'll receive. So if you earn over a certain amount, you'll have to pay higher Medicare premiums. Medicare premiums are based on your modified adjusted gross income, or MAGI, if you've heard that acronym, which is your total adjusted gross income plus any tax-exempt interest you might have earned over the course of the tax year. Now, to calculate your monthly premiums, Medicare looks at the income you made 2 years ago, which is your last filing. And if you were what Social Security considers a high-income beneficiary, you'll pay more for Medicare Part D and Part D, which means that for next year, 2026, they're looking at your 2024 tax returns. And if your 2024 returns showed your income was over a certain threshold, you'll pay more in 2026 for Medicare. Now, there are ways to appeal that or challenge that determination, but you would have to contact the Social Security Administration directly to do that.
It's all good information. Thank you. We appreciate it. Xavier, you look like you want to add something.
Yeah, so keep in mind if your income changes this year, it could affect your Medicare premium 2 years into the future. So for example, let's say 1 year you sold a property or cashed in a retirement account, and that caused a 1 year spike of your income for that year. 2 years later, you would have to pay a higher Medicare premium. Then in 3 years, your premium would go back down.
So who can I go to if I have concerns about how my income was calculated?
You can contact Social Security Administration to make any adjustments. If you need assistance, you can reach out to your SHIP at shiphelp.org to find your state SHIP office, where a representative can help you make an informed decision about your benefits.
Xavier and Andrew, I want to thank you for explaining all that in such detail. What about Part D drug coverage premium? Andrew?
Sure. Well, your Part D premium will change depending on the plan that you choose. There is no standard premium for Part D plans like there is for Part B. And as we mentioned, if your income meets or exceeds the higher income threshold, you'll have to pay more for the Part D premium. You might want to be wondering about Medicare Part C, which I mentioned is a Medicare Advantage. This, again, is private insurance companies offering these plans, which bundle the services covered in Part A, Part B, and usually Part D into one plan. You'll still have to pay the cost of the Part B premium if you buy one of those plans. So you'll, again, pay higher premiums if you're considered higher income. Some Medicare Advantage plans also charge an additional premium that goes to the insurance company that administers the plan. And this additional premium will not change based on your income, and it's intended for some of those extra benefits that they might offer. Now, again, if you need assistance to figure this all out, you can reach out to your local SHIP at shiphelp.org, and they can help you navigate this decision-making.
Well, Andrew, while we're talking costs, is there anything you'd like to share with folks who may be having some financial issues around Medicare?
Sure, and we recognize that Medicare impacts everybody differently financially. So one thing to do, certainly during open enrollment, is to review the coverage that you currently have. It may be possible that there's a new Medicare Advantage plan being offered in your area that gives you something, benefits that you would like at a lower price, or you may consider returning to original Medicare if that provides a better value for your needs. There are also programs that the federal government and state governments offer to assist in paying for premiums and out-of-pocket costs. These are called the Medicare Savings Programs, and they are administered by each state. And again, you go through your state office to enroll and sign up for these programs if you're eligible. And you can do this with the SHIP, and the SHIP can help you do it. Again, these help cover such things as premiums, deductibles, copays, and coinsurance. And there's a similar program that's specifically for prescription drug costs. It's called Extra Help Program. And again, you register for this through your state health insurance assistance program or the Medicaid office. And also, Medicaid is an opportunity also for people with certain low incomes. You can be eligible for both Medicaid and Medicare, which will cover pretty much all of your out-of-pocket costs if you meet certain eligibility criteria.
Thanks, Andrew. I think we've got time for just a couple more listener questions. Julio, who do we have on the line?
Yep. Up next, we have a question here for Xavier, and the caller is Joan from New York.
Joan from New York. Welcome. What's your question?
I'm a federal employee retiree. And what I wanted to know is that I didn't apply for Medicare when I retired. And when I finally did, I was penalized. Will I continue to be penalized for that because I didn't apply at the appropriate time?
Xavier?
Yes. So for Part A, there is a penalty, 10%, and that will last for double the amount of years you went uncovered. So if you went 24 months uncovered, then you would have a penalty for 4 years. Part B and Part D penalties will stick with you for a lifetime. In Part B, for every 12 months you go uncovered, that is a 10% penalty. And for Part D, though, for every month you go uncovered, you will have to pay 1% of the national base beneficiary premium. And for this current year, that is $36.78. The only way you can get those waived is if you qualify for an assistance program.
Wow. All right. Thank you so much. Julio, who's next?
Our next question comes from Andrew, and it's Patty from Maine.
Patty from Maine. Thanks for joining us.
Hi. My husband has been working, and at 65, we signed up for both A and B. But he was covered by a large company, Blue Cross plan, so we never picked up a Medigap. I'm wondering now, are we going to be penalized now that he's retiring at 70 to pick up a Medigap?
Good question. Andrew?
That is a good question, and I'm not 100% sure. I might need Xavier to back me up. I think if you've had supplemental coverage through your employer, you might still get that. I'm not sure if you have the special enrollment period or not. If Medicare was your primary payer and the employer coverage was a secondary payer, you might not have the special enrollment period, in which case I think Medigap would be able to have different rules apply to you. Xavier, are you familiar with this scenario at all?
No, but want me to tell you, we are looking it up.
Okay, well,
Yes.
Keep looking it up, and we may get back to it. Do we have another caller?
Yeah, we have one more question here, Derek. It's for Xavier, and Lily from Facebook asks, I am enrolled in Part A automatically, but not yet for Part B. Can I sign up any time during the year or only during open enrollment?
So open enrollment is only for making changes to if you're already enrolled in Medicare, so you have Part A and B and you're looking to make a change with Medicare Advantage plans or a Part D plan. To enroll into Part B, you will do that during the general enrollment period, which is January through March, and your coverage will begin the first of the following month. And it does seem that even a retiree does not get a special enrollment when it comes to Medigap.
Okay, that's going back to our previous question.
Yes.
All right, I understand. Do we have time for one more?
I believe that is all the questions we have, Derek.
All right, that's it. That's all our questions that we have for right now. Any changes? Xavier, you want to add anything? Well, no, wait a second. We've covered a lot of information. I want to go over a few key points, Andrew, so why don't you start for us?
Sure. Just to reiterate, again, open enrollment is every year. It's going to start real soon on October 15th and will last through December 7th. And again, any changes you make during this period take effect on January 1st, which is the beginning of the new plan year. So what you're doing during open enrollment is making changes for next year, 2026. And you can make these changes by contacting Medicare directly at medicare.gov or 1-800-MEDICARE, or by contacting your state's SHIP at shiphelp.org, or by contacting the insurance company directly if you want a Medicare Advantage or Part D plan. Now, if you like what you have and you're satisfied with your current plan and coverage, you don't have to do anything, and it'll maintain and roll over to next year. But it's still always a good idea to just research different options and see what's available to you.
That research would be key. Xavier, anything to add?
Yes, if you think you qualify for extra help, also known as low-income subsidy, a Medicare savings program, or Medicaid, please check your eligibility. And don't forget about the Medicare prescription payment plan if you have high drug costs.
Gentlemen, this has been a very informative discussion. Andrew and Xavier, I want to thank you for sharing such great information with us and answering some tough questions from our AARP members. On behalf of AARP, I want to thank you, our listeners, for participating in our call today. We hope you learned something new. Have a great rest of your day, and this concludes our call.